Want to help kids get their homework done? Well, an internet connection is a good start. But kids also need computers. And sometimes the hardest thing about homework is finding a place to do it. So why not hook community centers up with Wi-Fi for kids like us and all the amazing things we're going to learn?
Over the next 10 years, Comcast is committing $1 billion to reach 50 million low-income Americans with the tools and resources they need to be ready for anything.
I hope you're ready, because we are.
This holiday, let Hy-Vee do all the cooking so you can spend more time with family. Order your pre-made holiday meals today. You'll find delicious meals that serve from 2 to 12 people, including succulent turkey, honey-glazed spiral ham, or prime rib. Holiday meal packs are ready to heat and serve and include your choice of sides and rolls. For dessert, choose from apple, pumpkin, banana cream, or French silk pie. Meals start at just $34.99. Reserve your holiday meals today at Hy-Vee.com.
Gotta find me an angel.
You're listening to the Life After Loss podcast. This show is a safe place for angel moms and angel dads who have lost a child. It's a safe place to share, cry, celebrate, and connect to a community of parents who have experienced grief and gotten through it. Here's your host, Darcea Handy.
Angel moms and dads, and everyone who's joining us from all over the world. Thank you for joining us for this episode of the Life After Loss podcast. Something I want to say, if this is your first time here, I just want to tell you that my heart goes out to you. This is a family that we didn't choose to be a part of, but we are family nevertheless. You are not alone in your grief. You are not alone in your pain, and we are here for you. So I just want you to know that if there's anyone new joining us or any family members or anyone who's experienced pregnancy and infant loss, you are in the right place, because we're just going to wrap our arms around you virtually, and we are here for you. Now, angel moms and dads, I know we have all seen the news, and we all know that we just celebrated not long ago our very first Maternal Health Awareness Action Day. And I have to tell you, as a healthcare professional, someone who has been an advocate for maternal health care and reducing infant mortality rate for over 20 years, this was really exciting for me to see. It was exciting for me to see this administration take this very seriously. And angel moms and dads, I want to say why this is so important to us. Remember, not long ago, I have a show. You guys can go back and look at it. And it's talking about awareness and advocacy. And I'm talking about how important it is to use your voice. And let me tell you something. I know people say all the time, okay, I'm one person. Guess what? One person makes a difference. Guess what? We're a family. We're an army. We're a team. And we are getting it done. Guess what? Continue to reach out to your local, your state, and your federal legislators. Continue to write those letters. Continue to get awareness out there, and let's get these laws on the book. What touched me about that day, which I want to say was December the 8th. I would like to say December the 8th, 9th. I'll double check on that, but I'm pretty sure it was a Tuesday. We are now seeing an administration that's actually putting money behind what they're saying. They're telling us, we have this problem in this country. We know that we do. I also have a podcast on that. I have an episode on that where I talk about how we are one of the wealthiest countries in the world, and we have a high mortality rate. We have the highest maternal mortality rate and infant mortality rate. And in the state of Texas, it's even worse. So to see this administration say, hey, we are taking maternal health and wellness very seriously. We are taking infant mortality very seriously. We want to see these numbers reduced. We are tired of seeing these women die after giving birth or within 1 year, because infant mortality rate is 1 year, birth to 1 year. And maternal health is birth to 1 year. They're tired of it, and they're putting money where their mouth is. And I especially appreciate the talks of there being a hospital, a maternity hospital, a maternity health hospital. Angel moms and dads, you guys know why this touches me so much. You know the experience that I had when I lost my son. I just felt like I did not get the very best support that I could have had where I had my son. And I felt like it could have been, one or two things. Maybe they weren't educated in a way to help me. Or I felt like the physician at that time, he didn't know me. It was 2-something in the morning. He was the physician on call. They called him. They said, this woman is here. And I was just another person to him. I was someone that he had to probably get out of his bed for 2 a.m., in the morning after 2 a.m. I can't even tell you what he really looks like. I remember his complexion, but that's about it. He didn't spend any time with me. I know the nurses were talking to me. So for me to know that there's money that's set aside that's going to be put in place to build a hospital that's just a maternal health hospital, it really makes me feel good, and it makes me feel like the work that I'm doing and the work that you all are doing and the work that we're doing to spread awareness is actually going to pay off. Now, we know that we got to go to the polls and we have to vote, and some of these things are going to have to be passed. So make sure you're sending your letters. Send those letters, like I said, to your local politicians, your state politicians, and your federal politicians. It's okay to attend some of these meetings, your town hall meetings, your city council meetings, even your school board meetings, because a lot of your school board members end up going into politics and higher levels. And you want to be there because you want your voice to be heard. That's what I do. I have been yelling because angel moms and dads, let me tell you why this is so serious to me. And I'm going to try to get through this conversation without the waterworks. But when before I graduated college, my first job was with the health department where I was living, and I was an intern there. And I ended up writing a grant, and I wrote a grant. My grant was funded, and I had 3 programs. So one of my programs was an infant mortality awareness program, and in that program, I had young women, high risk pregnant women in that program is what it was. And I followed the baby after the baby was born. I followed the mother and the child for a full year to make sure they were healthy. And the program was really well, and it went, it was very productive. I was actually featured in the newspaper there, and with one of my teen moms. And, I went out and I did the speeches, and I was on news shows and radio programs and all of this because the program was very successful. I'm very grateful. But then it happened. Then I was pregnant with my son, and then I lost my son. And it shocked me because I said, how can this happen to me when I have an infant mortality program? I put the rules together. I'm the person who goes out and teach people how to take care of pregnant women. But at that time, no, I wasn't a nurse. So I wasn't talking to people in the hospitals. So after I lost my son, and you guys know, because I talk about this on the advocacy episode, I said, I've got to do something to change what's going on. I didn't like the way I was treated. I didn't like the way I had to stay on that floor with everybody else with their kids. I didn't like any of that. And it certainly hurt me that I had a program helping people save their babies and have healthy pregnancies. And I felt like I did everything right. I'm like, I'm the expert. That's how I felt at that time. I'm the subject matter expert here. I know about infant mortality. I mean, I was even a child passenger safety technician. I knew how to professionally put the child passenger seats in the car. I mean, I just felt like, hey, I'm at the top of this. But even me, I lost my son. And when I decided that my depression needed to move to the side and I needed to take some action, that's what I got up and did. And I told y'all in the advocacy video that I have seen changes at the hospital that I had my son in. So I know that change is coming, angel moms and dads. We just have to be, I'm going to use this word that that my sister likes to share, and it is consistent. It's just going to take consistency. This didn't happen overnight for us to get this maternal health awareness action day. That was in the making. Those letters, these programs that we have, this has been in the making, because guess what? When it's you, it's me, it's my neighbor, it's my friend, it's 1 in 4, it's too many. 1 in 4 is too many, especially where we are in this country. So the fact that this administration is taking the time to hear us and see us and do something for us, I think it's great. And we've got to stay on them and hold them to task. They've put it out there. They've let the world know that they are going to reduce infant mortality rate in the United States. They've let the world know that maternal health is very important. They have let the world know that they're tired of women dying and their babies dying after birth or within that first year of life of the infant. They have let the world know, and we have to hold them to task. So stay diligent with what you're doing. Stay consistent. Continue to write, everyone, and continue to fight to make sure that we do everything we can to reduce infant mortality rate in our communities. We're doing everything we can to get the best health care for pregnant women. We have to do that. You know, we're raising the future. We're the ones who are birthing the future, right? We're having the children. So why can't we have better health care? Why can't we be treated better in the hospital? Why can't someone come in the room with compassion instead of someone who's watching their wristwatch, trying to serve all the patients at, during their shift? I have to be someone to you. For you to care about me, I have to mean something to you. So I need someone who has a little bit of compassion when I'm in the hospital getting ready to have my baby, or when I'm going for my doctor appointments, to make sure I'm doing all of my prenatal care. And then after I deliver my child, or I need someone who cares about me to say, hey, because of your medical history, let's do these tests to see if your baby may have some type of birth defect or congenital problem, or something that we can find early, or hey, your history shows me that you've had a miscarriage before, so let's try this cerclage, or what I call the purse stitch. We're going to do that for you because we want to make sure that this time we do everything we can to help you keep your baby. Okay, we want those things to happen. We want to see it. Okay, so we have to stay on the front line. This is not the time to give them a break. It is a celebration, but it's just the beginning. We have to hold them to task, hold this administration to task, hold our politicians to task, because that's the way change happens. And I'm so proud of each and every one of you who are standing up and fighting for maternal health rights, and fighting to see infant mortality reduced and hopefully eradicated. We don't know what's going on. We don't know what would happen, but the attention that's been placed on it, I'm very proud of it. And I'd like for you all to share with me what you did on that day. For me, I haven't even told you guys, but I partner with a doctor's office here, and I provided, the Life After Loss podcast and the Life After Loss Ministries volunteers. We provided essential care items for postpartum families. So in an area of need, it was in a community of need. And the doctor was so pleased. They were like, can we do it again next year? And I was like, absolutely, because that's what we do here at ShalettaMakesMeLaugh.com. We reach out to our community. So angel moms and dads, drop in the comments and let me know what you did on Maternal Health Awareness Action Day, and let me know how you feel about what you saw when the administration, the Vice President, went on and spoke about Maternal Health Awareness Action Day and this new birthing hospital that we're supposed to be getting in the States. So Angel moms and dads, as I always say, take care of yourselves and each other. I love each and every one of you. And until next time.
You've been listening to Life After Loss with your host, Darcea Handy. Subscribe to the show wherever you get your podcast for new episodes every Wednesday. For more on this program, log on to ShalettaMakesMeLaugh.com.
Whatever your life story, you deserve access to comprehensive, affordable health insurance. But it can be hard to know where to start. That's why Minnesotans have MNsure. MNsure is where you can find health coverage for every Minnesota story, regardless of where you live or what your income is. MNsure is the only place where you can access savings to help lower the cost of your health coverage. And you can get free help in person or over the phone to enroll in a plan that fits your needs and your story. Visit MNsure.org today to get started.
It never fails. Every fall, I fall into a funk. Daylight savings time used to have me singing the blues until I found some help at BetterHelp.com. BetterHelp.com. It's an online resource that matches you with your own licensed professional therapist. Listen, ain't no shame in talking to somebody about how you feel. Your mom and your friends are great to talk to when you have problems. They're your go-to. But sometimes you need a professional, and that's where you need to call BetterHelp.com. Sometimes it's the only way to get your happy back. BetterHelp.com offers secure online counseling, either over the phone or via video. Now, it's not a crisis line, but BetterHelp.com has counselors who'll help you with your anger, stress, depression, or anxiety. The good news is that they're more affordable than traditional in-person counseling sessions. But you know what? If your money is funny, don't worry. BetterHelp.com even offers financial aid. Let BetterHelp.com help you get your happy back. Log on today to BetterHelp.com.